So I think Jim set that up quite nicely, really. Jim's been working with us as the voluntary sector and patient carer service user representative on the Sustainable Primary Care project, as well as a whole set of other projects. I don't quite know how he fits it all into his day. For about the last 2 to 3 years now. So we'll talk about where we've got to and where we've come from on sustainable primary care. I brought with me some of these easy read documents. The Sustainable Primary Care Strategy is quite a thick document. It's available if you want to download it. But this easy read document is literally just a few pages to tell you what's in the strategy and why we're focusing on the areas that we're focusing on. But hopefully through this presentation that will become clear. As ever, please ask me any questions as we go through. I'm going to try to keep to 10 to 15 minutes because I'm sure you're all more interested in what's happening around the future hospital, and Helen and Bernard are here to take you through their presentation as well. So, hopefully you'll see how this fits together. Health and social care is being redesigned, so I'm sure you'll all remember the green paper, the white paper, P82, that looked at what do we have in Jersey at the moment, what's great about our health and social care services, what kind of issues do we have as islanders, and what are we going to need into the future, and is there a mismatch between them? And it helped us to get on the front foot back in 2012 with support from the States to redesign health and social care. The main thrust of this was to build up services in community and primary care settings in order to relieve pressure off the hospital. Because when we did the original work, we found that we didn't have 24-hour services in the community, there wasn't choice at end of life, got lots of doctors, that's great, but not quite so many nurses, and that was impacting on recruitment and careers as well. So that was the background, I'm sure you can all remember that. We've done a lot since then, so we've finished our first 3-year investment period, and we now have lots more services in community and primary settings, like Jersey Talking Therapies, like community midwifery, like rapid response and reablement, which hopefully some of you are aware of or know people who have used. So these services, particularly rapid response and reablement, is there to pick up people from hospital who really don't need to be in the hospital, or to help people to come back home if they're not quite ready to come home after their hospital stay. They need some reablement, some activities of daily living, or they need to learn how to look after themselves again. So it helps them to come back home in a nice managed way, rather than being stuck in hospital for longer than they need to, or going into hospital in the first place when they didn't really need to be there. We launched the strategy back in December last year in the media, so it was in the JP and on the news. And what did it say? It's on purpose that we've got patients in the biggest blob right in the centre, because that's what we have to remember this is about. It's about listening to what people have told us and about making services even better in their own homes, in your own homes, and in community and primary settings. And when we're talking about primary care, we don't just mean GPs, we also mean dentists, optometrists, pharmacists and community nurses, so district nurses, health visitors, rapid response and reablement. But putting it right in the middle helps us to remember that it is about islanders, it's about patients and carers. So the strategy says that we need to continue to listen to what people have said and understand what challenges people have. Do they have problems with access? And this is particularly relevant for things like this forum. Are people finding it difficult to go to their GP because they have to go up a lot of steps, or to go to their dentist because there isn't parking nearby? What do patients want? And importantly, what did people recognise was good about our services right now? And that's where the Consumer Council came in. Ambition 2 was about payment. So we heard a lot from people, and you'll see a slide in a moment, that sometimes people find it quite difficult to budget for and to pay for their primary care. You pay in primary care and it's free in the hospital. So what do we need to do about that to help people to access care in the right place? The third one was about partnership, and this is a theme throughout all of our system redesign, our transformational change. Helping different professionals to work together with the voluntary sector as partners and with patients and carers as partners as well, to deliver the best care to people where they want and need it. And that sounds a bit management-y, but it's basically about saying, I don't really mind if my care is delivered by a doctor or a nurse, as long as it's really great care. What I do mind is if they don't speak to each other, and I have to tell my story 3 or 4 times. Number 4 was about people. So this is about, if we need more of certain types of staff, how do we make it attractive for them to come to Jersey? For islanders who've trained in the UK, how do we make it easy and attractive for them to come back home and deliver care back home rather than staying in the UK? The processes is about governance and IT. So we know from international evidence that you need good IT to talk to each other to be able to make sure that we've got the right type of care that's well planned. And that's the fundamentals. The patient's right at the centre. We need to keep the best of what we've got. We don't want to bring in a new system or a new service from somewhere else and just lump it onto Jersey, because we know it won't work. And we've got some great aspects of care. But there are different ways that we need to start working to be more integrated, to help doctors and nurses and social workers and the voluntary sector work together with patients to get even better care than we have at the moment. So these are the sorts of things that the Consumer Council found when they asked people, what do you think about primary care, particularly GP practices and GP services and dentistry services. But importantly, you can see from this comment here, that one of the things that actually quite surprised us was that islanders really recognise that if it's free, it might be abused. So where are we now? We've been working on this for, really in earnest, for about 2 years. We've had a big steering group with GPs, dentists, optometrists, pharmacists. Jim's been there, Bernard's been there representing the hospital, because it was really important to get lots of people's views, but also to make sure that the different services and the different streams of development linked together. So there's no point in having a brilliant primary care system if we haven't got a brilliant hospital. Or if we put all our focus into the hospital and we forget about community services. We have to keep making sure the whole lot works together. So Seb's going to take you through, just quickly, what we are doing in terms of the pilots and how we want to test out these new ways of working. Because there could be some quite big changes, and we need to make sure we're doing it in the right way and doing the things that doctors, nurses, social workers, patients think we should be doing, rather than us just sitting in an office and deciding what needs to be done.